no community or human-to-human transmission in the United States.
In an effort to alleviate public fears over the novel coronavirus and its potential to arrive here in San Diego, County Public Health Services held an informal press conference to answer questions and let everyone know that there is a plan in place and that they are prepared.
There are only 5 cases identified so far in the country. All are travel-related and none are in San Diego. We have only 1 patient under investigation at this time, a person who's doing very well without symptoms currently on home isolation and is awaiting test results from CDC.
The CDC is the only lab that can perform the test to identify coronavirus, and it's taking longer than usual due to the high volume of people being tested across the country. Here in San Diego, they have been receiving an average of a dozen calls a day for the last 2 weeks.
We have ongoing surveillance for possible cases. Caregivers in the community are consulting us on possible persons to investigate using the current CDC guidelines for risk assessment.
But the most important message is that the risk of infection is very low to the general public unless you have traveled to China or anywhere else internationally that has a high number of cases. But they say they do expect to see cases here in San Diego in the future, and for that reason they are ready.
The county has a comprehensive system in place to monitor and respond to any situation that could arise that might stress the emergency healthcare resources.
So again, no confirmed cases here in San Diego, 5 in the United States, 2, 1 in Los Angeles, 1 in Orange County. The one here is not confirmed yet, but none of them are person to person, meaning you were walking down the street and someone got sneezed on or a relative kissed somebody else. It is all these people were traveling to China and they brought it back here. So that's really good news for us here in the United States in terms of containment. It's also really important to point out we're at peak flu season, and already there have been 39 flu deaths, influenza deaths here in San Diego, and 11,000 cases. And so really you need to follow those exact same protocols. Wash your hands, use good hygiene. If you are sick, stay home, and also be very polite, or cover yourself when you're coughing or sneezing, things like that. So right now the risk, they're saying, is very low. Of course, we're monitoring this one case where this person is in their home in quarantine, but in their home being monitored. So of course we'll stay up on that. For now though, we are